Alright, so today I'm going to do an acapella and I'm going to show how to use that. So the first thing I'm going to do is check the patient's chart, and then I can always coincide if they had a nebulizer treatment, then I can do an acapella because the medication that they used with the nebulizer can also help with loosening up those secretions and help them cough them out. So the first thing I'm going to do is I knocked on the door, introduce myself, check the ID band, assess the patient, check their vital signs, and then I'm going to explain what this machine is. So this is an acapella. So this is going to create a fluttering in your lungs, and this will loosen up any secretions and help you cough them up. So I'm going to set this at the lowest resistance. So you see there's a dial, and you'll set it towards the negative side just to start them off with, to see if they're able to do it on their own. If they aren't, then we will just figure out something else if this does not work for them. But we'll have them sit upright. When we have them sit upright, then we'll have them set their elbows on a table, and we'll have them hold it like this, or even just hold it with one hand as long as they have a good grip on it. Instruct them not to include the end piece because that can cause the fluttering not to work, and it can cause it not to properly make that fluttering inside the lungs. So when we're ready, we'll instruct the patient. So we're going to have a 1-to-3 or 1-to-4 ratio. So we're going to breathe in 1 and exhale 3 to 4 seconds. So when they do this, we'll do about 4 to 8 times in the 10-20 minutes, but we have to have them after every couple of these. We have to do 10 to 30 breaths in between, so that way they don't get lightheaded, and if they are feeling lightheaded, then we won't do as many in the time being. So when we're ready, we'll have instruct them. They'll have a mouthpiece, or they can even have a different mask or something to help them if they can't quite get that tight seal around it. So when they do this, we're going to have them take a nice deep breath in, then exhale, and have a nice strong exhale, but we don't want to do forcefully or else it's not going to get that fluttering. And when they feel resistance, then we need to tell them to continue on until and make sure they get that fluttering going. And if they cough up anything, we can have a little basin to have them cough into, or even if we need a sample, we'll have a sample cup with their name on it and everything to send to lab. Then we will chart down what it looks like, and if it has a distinct odor, anything like that. And every time we do this, we'll always have them cough to make sure if they have any loose secretions, then they can cough them up. Have a nice deep cough. Like just get them out of their system like that. And so then here's a bag. Comes with a bag. You can put the patient's name on it, room number, and then you can place this in here. You can take the mouthpiece off, and you can wash that with sterile water. But this, instruct them not to put this into water, as it can ruin the device and may cause it to not work properly again. So we would set it next to the bedside if they need to do it again the next hour. And then otherwise, we can just set it off to the side until we can make sure we help them. That way, instruct them, make sure they are doing it properly every time. When I am done with that and it's off to the side where it needs to be, then I'll reassess the patient, get the vital signs after everything. I'll auscultate the lungs, listen to the lungs, see if it's helping, clearing out some of those secretions, no crackles, not as many crackles, and then I'll go and chart on the patient's charts, and I'll let the doctor know that I did an acapella treatment with them.